Call to order the Information Committee meeting for Wednesday, April 22nd. If we could have roll call, please.
Ron Weifenbach, Hattie Martinson, Sam Quaker, Deb Hadcock,
Here.
Willow Krepke, Karen Gunderson Olson, Ron Kroger, Lloyd LaCroix,
Here.
Aaron Costello, Malcolm Chapman.
Here.
We now take roll call, Katie. It's all good. Okay. I'm losing it a bit. We are going to talk about the reentry program, fiscal empowerment, and the Bank on Rapid City initiative today. Barb has a few things she wants to share with us. If you have questions, council, in between, please put on your light, and they will answer the questions. So I think we have Ray Astrick first on the reentry program for offenders.
There we go. My name is Wayne Ashbrook with the Rapid City Police Department, and of course, I'm here to talk to you about the Rapid City Reentry Initiative. The Rapid City Reentry Initiative was originally formulated by now Chief Steve Allender. I assume that he came up with this idea several years before that, and when he finally became chief, he decided that he was going to allocate some resources, which in this case happened to be me, to look at the possibility of a reentry program. And reentry is basically to give those people that are coming out of the correctional systems every opportunity to succeed when they get back in our community. Because we know that it costs a lot of money to have people stay in those correctional facilities. If we can keep them here and make them successful in our community, it will save us tax dollars. Also, if you think about it from a public safety standpoint, it's going to make our community safer. Fewer crimes being committed, fewer victims of crimes. It just makes sense. And that was the reasoning behind the chief's idea to look at the reentry program. The very first thing I have is a little 6-minute video, and it is a snapshot of some of the reentry programs that have been successful across the nation. And the reason I put this in here is to sort of give you an idea and look at all the different aspects that these reentry programs are supposed to look at and take into account when they're deciding how to make these people's lives better and to give them those opportunities that I was talking about.
I'm a recovering addict. I'm also an ex-offender. And I've not been incarcerated or in any type of legal problems for 20 years. And I've not used a drink or a drug at 19. So I understand the challenges that someone faces in transitioning from not only inside of the walls to outside of the walls, but from inside of that prison up here to the freedom that we can receive once we can replace that old misinformation, not only misinformation, but missed information.
Outside the Walls, a national snapshot of community-based prisoner reentry programs that provide education and employment, a continuum of health care, supportive and transitional housing, address public safety, family services, and faith.
The Justice Department's mission is the protection of the public and prevention of crime, and we think that the chief responsibility of government is public safety and the protection of citizens. Well, we found through our Bureau of Justice Statistics that of offenders leaving prison, some 67% repeat offend, recidivate, in other words, within the first 2 or 3 years of the time they get out. Now, that is a great danger to society. And at the same time, on the other side of the coin, there's a very good reason why this happens.
More than 600,000 people are being released from state and federal prisons each year, 4 times more than 25 years ago. crimes for which people have been sent to prison cover a broad spectrum, from nonviolent drug crimes to serious violent felonies. On average, these prisoners will have served 2.5 years. Not only are more prisoners returning home than ever before, they are returning less prepared for life outside. The most recent national statistics show that more than 2/3 will be rearrested within 3 years, and 1/4 will be returned to prison for committing new crimes or parole violations. First and foremost, this is a public safety issue.
I was an assistant DA during that Massachusetts miracle period where there was an all-time low in crime, and that was because there had been partnerships between the DA's office, the Boston Police, the faith-based organizations, and the neighborhoods. And I think the lesson that was learned when crime started to spike was that you could have an impact on how you prosecuted crime and keeping crime low, but you still had to deal with the people who got out. And if they got out no better than when they went in, they were still going to immediately return to those communities and have an impact.
So it's not a question of whether we should release people from prison. It's a question of, given the fact that thousands and thousands are being released every month, what can we do to make sure that when they come back into society, they're not going to reoffend, and they're going to get a job and have housing and get health care and get back on track.
In each state, the majority of people released from prison or jail return to just a handful of neighborhoods, which are especially ill-equipped to receive them. Underserved, these communities have high rates of unemployment, little affordable housing, and insufficient health services and drug treatment programs. The racial composition of these urban areas also mirrors the prison and jail populations. They are disproportionately people of color.
And if we don't prepare to make adequate places for folks, if we don't prepare to receive them, to work with them, to give them meaningful opportunities, I think we're going to be in store for a difficult time, because they're not going away.
These are people who know how to do one thing, but they really haven't had life skills, job skills training. There are literacy or other education issues. There may be drug addiction, or at least drug dependency issues, some very serious issues that are obstacles to people who are returning from prison, not to mention the stigma of being an ex-offender.
So for us as a society, the question is, how do we provide support and services and supervision for people coming out of prison to help them meet some of those very real, very basic challenges of reintegration?
Programs presented in this video illustrate some of the exciting ways that jurisdictions are beginning to think, work, and collaborate around the pressing issue of prisoner reentry. While some of these programs represent promise to the field, many are too young to assess. They were nominated by a select group of experts in the field, including researchers, practitioners, policymakers, and funders who are engaged in the topic. The video highlights collaborative efforts among corrections, law enforcement, faith, and secular organizations, presenting their diverse points of view. Interspersed throughout, the video also provides the perspectives of victims and victim advocates, as well as those responsible for public safety, including the U.S. Department of Justice and legislative leaders. Focusing on issues such as employment, health, housing, faith, family, and public safety, the programs shown in the video assist people before they are released from prison and immediately after they return to the community.
So as you can see, you're looking at the whole person when it comes to programs like this. Not just one aspect, because I think most of us realize that there's never just one thing that fixes a problem. It's always a culmination or a combination of things that come together at the right time to be able to address a problem and create a solution. And that's what we're trying to do with the reentry program. And here's one of the things, and this was one of the deals that was difficult for me as being a police officer, because we have a certain perspective, don't we? And when I went and gave this presentation to the law enforcement officers in the community here, the Pennington County Sheriff's Office and the Rapid City Police Department, I had to get across to them that this is not hug-a-thug. This is not supposed to be one of those things where we will put a blind eye to some of the things that are going on with this person. No, they will be held accountable just like every other person in the community. And so this lady here from the Boston Police Department says it very well in this short little
This is not hug a thug. I will tell you that right now. We are not warm and fuzzy. We are not social workers. However, the one thing that I think the police department has learned in the last 10 years is the importance of partnership and knowing what we're good at and then reaching out to those people who are good at doing other things.
And that's what we've done. We've reached out to those nonprofit organizations in our community that are already dealing with these people on individual basis and bringing them together and creating a committee and creating a program that will address the whole person across the entire spectrum. That's the idea. Talk about some of the offenders in our community. You look at all the different correction systems that are out there, federal, the Pennington County Jail, the South Dakota Department of Corrections, and these places are continually releasing people back into the community. And the Pennington County Jail alone, in 2007, released over 11,000 people back into the community. Now, the Pennington County Jail covers more than just our county to some extent, but it was almost 10,000 people were back right into Pennington County itself. That does include repeat offenders, people that were in and back out, and in and back out again. But just think of the impact that these people have. And if we can address some of the things, some of the issues they have, then hopefully we can get them to stay out of jail, stay out of that correction system. And Pennington County right now has what they call the rebound program. And they were addressing, in the beginning, they were specifically addressing more mental health and medical issues. And they were making sure people stayed on their medications because they know if they went off their medications, they would most likely have contact with law enforcement and they would most likely end up back into the correction system, back into the Pennington County Jail. And within a year, they saved the county about $1 million just keeping those people out of the county jail. So it's already been proven in our community that these things can work. And that program now has blossomed and it is diversified and it's taken into account more things, housing and some of the other things. And they are also part of our program. We're hoping to make this a program for the entire community that will address everybody. So these people are continually coming back to our community. We know they're here. There's no getting around that. It's not like lock them up in jail and leave them there forever. No, they are going to get out. 90-something% of the people that are in the prison system are going to come back to your community sometime. What do you want to do? Ignore them, put barriers in their way to being successful, or do you want to knock down some of those barriers and give them the opportunity to succeed and become productive citizens in our community? I started looking at some of the dollar costs. And here, if you look at that, that's the 2009 average daily count for the Department of Corrections, for the State Department of Corrections. 3,451 people are locked up in the South Dakota Department of Corrections facilities across this state. And so if you look at how much does it cost to house a person for one day, in the South Dakota State Penitentiary, it costs $69 a day. You do the math, that's easy. $238,119 is what we spend per day to keep people in jail. Our recidivism rates in South Dakota, about 30% of the people that get out recidivate within a year, 39 within 2 years, and about 45% within 3 years. In 2007, they released 2,072 people back into the communities of South Dakota. So if you start looking at the numbers, you'll realize that we had 932 people that recidivated, so we're spending $60,906 a day for people that recidivate and go back into the correction system. What can we do to reduce that? That's what the reentry program is all about. If we can reduce that by 100%, that'd be a $22 million a year savings. We know that that's probably not going to happen, but we start looking at that in 10% increments, which is what we're going to work on, 10% a year over the next so many years to try to reduce that number. We can save a lot of money. You're looking at over $2 million a year we can save for every 10% that we can stop from recidivating and going back into the correction system. when I started looking at reentry and how I wanted it to work, I just came up with this basic diagram. And if you look up there in the upper left-hand corner, we're talking about the correction system and all those pre-release programs that they have. GED, get in there and learn some kind of a skill. All these things come together. And when we get people that want to be in the reentry program, that's the very first thing we're going to do is tell them, you need to take advantage of those programs that are within the correction system. And if you can do that, then you've definitely showed a propensity to want to stay out of jail, want to come back to the community and do something with your life. And so one of the things that we're doing based on that is that we need to try to get interviews with these potential clients well in advance of their release date. That way we can come up with a consolidated plan that our experts agree is good for that person, and also that that person will buy off on and say, yep, I can do that, I can make that work. Because if you try to shove it down their throat, they're going to rebel, and they're not going to want to be a part of it. So they have to be in agreement. So it takes extensive planning by that reentry center. And if you look on the right-hand side, you see all the different aspects that we try to cover: life services, housing, health, education, family, employment, faith-based, and then of course system oversight. System oversight happens to be probably parole, probation in some cases, and of course law enforcement. Hold these people accountable, just like we hold everybody else accountable in our community. So if you think about all the different appointments that have to be made for this one person, it can get to be fairly complicated. Well, the reentry center needs to try to keep it simple for these people. When they come out of that structured environment in the correction system, and you try to throw them in the mix here, and you've got, okay, you have an appointment today, and you have 2 tomorrow, and 3 the next day, it can be overwhelming. We don't want them to throw their hands up in the air and say, forget it, I'd rather be in jail. We don't want that. So one of our jobs is to keep that plan, or make it at least appear simple for that client. So I decided I needed to look at the reentry center itself. And the reentry center can be, it just depends on where we want to put it. We need a location, of course, but I decided that an admissions committee, which you see in the center there, is probably the way to go. Have the admissions committee look at the information that we can get from the Department of Corrections, formulate plans, and then push those plans out to either mentors or primary case managers. And those primary case managers or mentors, their job would be to keep that person on track and make sure that this appears to be simple to that new client. And so you can see that you're going to try to get all these mentors involved, and you have to be careful of their caseload also. If they get overwhelmed, they won't be able to put quality time into that client when they come out of the correction system. So that's another area I have to be careful. Also at the top there, you can see that is going to be the reentry coordinator. That is a position that we've thought about to some extent, and is going to be very important on being able to get the information from the correction system back to this admissions committee and into our reentry program, and also to make sure that our mentors and our primary case managers are keeping in line with what needs to be done. And also, if you think about it, we're already looking at federal dollars to be able to get grants for this program. That person needs to be able to keep the statistics that we're going to need to be able to show that we're successful. So that's the reentry center in a nutshell.
Thank you, Wayne. Is there any questions from the council? Lloyd LaCroix, please.
Thank you, Chair. Wayne and Barb, I really appreciate you guys doing this. It's been about 10 years since I worked at Detox, but I mean, we had programs down there for the BOP and DOC, but I think those were more or less for the Bureau of Prisons. We had like a pre-release program for them, but the Department of Corrections type program was more or less if they'd violated it, that was a place to come to get reorganized, go through anger management treatment before trying to get pre-release before. But I like the concept. I like the pre-release interviews, so you guys check who to bring into the program, who you guys see potential as making it. I like that part of it. I really do, because I think that makes a difference in the community if you can get someone early on and see that potential compared to some people who may already, afraid to say it, institutionalized. I mean, there are some people that are just plain
Very true.
institutionalized. And so I like that. So I'm eager to hear more of the information and see how you guys move forward with this, because I think it could be a good program. Thank you.
Thank you, Lloyd. Good comments. Malcolm Chapman?
Thank you, Madam President. Wayne, I understand the goal to reduce recidivism rates. Are we thinking or working with potential partners, though, in initially keeping people out of the system initially, or is that not a role, or is there a role for the Rapid City Police Department in that, or is that a role for other programs like Strengthening Families or Youth Challenge, or is there a role for our police department in that as well?
I look at that as a role for both. It's a combination thereof. Not only do we have to look at their family situation and their job situation and all of that, and those different organizations are very good at what they do already, but our role is to not be that come down hard enforcement on them, but to visit them once in a while. And we have done that in the past, where we actually go and visit the parolees in the different officers' areas to see how they're doing and to make sure that they're there. And we do parole checks with some of the parole officers. So that is what I see as our primary role as the police department in this kind of a structure, in this kind of a program.
Do you have a follow-up, Malcolm? Okay. Just a couple questions. How do you educate the people that are coming into the reentry program? Do you, every prisoner or person that's coming out, parolees, are you giving them a little slip that says this is our reentry program? I mean, how are they knowing about your programs?
Our program is mainly promoted by the people that are in the correction system now that know that we have a program here that is willing to help them. And that's our primary promotional aspect right now. But that's another thing that we need to do, and this program is just in the beginning stages here, is to create something so that maybe even a brochure like what I handed you, and so that that can be given out when they enter the program that the South Dakota Department of Corrections has, which is the Community Transitions Program, to show that, hey, once you're out from under control of that correction system and you're back in the community, you're not just left out there by yourself. There is another program that will continue to assist you, and we're sort of the natural extension of their program. But once they're out in the community, we can assist them, and that's what we're supposed to be.
So anytime you're out in the community as a parolee, you will try to hit them with this pamphlet and tell them that you guys are here to help. That's basically what you're going to be doing.
That to some extent, but hopefully they know about it before they ever get out, so that they know, hey, I already have a plan. I don't have to worry about whatever it happens to be, housing or my family. I've got these programs in place that will assist me along the way.
It seems like you talked about some people want to be educated while they're in there, and they seem like the ones that actually want to make the difference when they want to come out. Do they hit a certain target area of parolee type people, or are they just giving it to, or are they just telling everybody that's coming out that there's this program? Is that how you're going to do it?
Right now, of course, if they're involved in some of those programs in the correction system, it shows, and it's definitely a good indicator that they want to make something of their lives. But, trying to say here, but
I guess what I was trying to say too, Wayne, do they evaluate that according to the people, or does everybody, I know this is just getting on its way, so maybe I'm asking questions that are too far ahead of the system of where you guys are going, but I was just kind of, and like the transitional housing part, do we have any of that hooked up as well yet?
I'll let Barb.
Let me answer that for him. In prison, the CTP program, that transitions program, they tell all of the people coming in that this is available, and if they would choose to go into that program right from the day they get to prison. And then at exit, then they will notify us for the group that is in their program. For those who are coming out, we are working with them to try to get them to provide them with the information about our program. At that point, they're saying, we don't want any help, we've flat timed out, we've served our time, we just want to be gone. But once they get back to the community, they may still need help. Once they get here, they may realize they need help. So we're wanting them to provide them with information about our program for all of the prisoners who exit. And so that's one of the things we're working on. And then as far as transitional housing for prisoners, there's very little here. There is some for substance abuse, for people who have substance abuse and alcohol problems through the Friendship House. And there is some through Cornerstone Rescue Mission if they don't have those issues, but they have for sex offenders. They will allow some of the sex offenders to stay there for a period of time until they're able to find housing and a job. And if they have a family, they could qualify for the transitional housing for families with kids through Cornerstone. But other than that, that's about all we have right now for transitional housing. We're trying to work towards putting them directly into housing rather than the transitional. That ends up costing a lot more because then you have to have staff and security and everything that goes with that. Whereas if we move them into mainstream housing right away, there's been more success elsewhere.
Thank you,
That's what we're
Barb and
finding.
Wayne. Sounds like it's a work in progress.
Definitely.
And it sounds like you guys are well on your way to doing something very positive. So I think what you're doing is awesome. And we do have more lights here, but the program sounds like you're doing a really good thing for the community and a great savings for state or any program that's to do with this. So Lloyd LaCroix, please.
Thank you, Madam Chair. I guess I was a little confused at the beginning. I thought it was going to start from the prison interviewing there, but I mean, it does make sense what you guys are doing because like the Friendship House with the pre-release, and I know the biggest problem with these people after working with them is number one, transportation, the housing, the work, and that's what the pre-release is trying to get going, but even they struggle there with that. So I think this is a good stepping stone to get going, and I appreciate you guys moving forward with this. I guess, yeah, when you guys come up with the center with more information, I would be very interested in being a part of that. Thank you.
If I could, I'm going to skip forward a few slides here. This is my parolee dots, all the parolees that are in our city and all the sex offenders that are in our city already. But I want to get to, that's all the people that are involved already. Those are all the organizations that are involved already in our program. Just goes to show you the support that we had. But here's the one here. This is what I wanted to show you. What's the future hold? I had this, I don't know if you want to call it a vision or whatever, but when I started this, I started to think, why should we give these opportunities just to those people that are coming out of the correction system? So we've morphed this to some extent. This one-stop center that we're hoping to get in place should be for anybody in our community that needs assistance. Not just if you're an offender or an ex-offender or whatever. Anyone in our community. And so that's the benefit to our community as a whole, is that one day this will be for anybody that wants it, anybody that needs it. And that's the idea behind this. Yes, the offender program, the reentry program will always be part of it, but eventually this is where it's going to go. That's what we're hoping for.
I apologize, Wayne, because I
No.
thought you were done with
No,
your
that's
slides.
fine. No, that's fine. That's all right. I sounded like I was done. I know it.
It's okay. Do you have more slides? Because we have another question.
Yes, ma'am.
Okay. Aaron Costello, please.
Thank you, Madam President. I guess, Wayne, if we could go back to those slides you skipped over, and
Yep.
I'd like to hear everything you have to say, and then I'll see what questions I have left.
Where was I at? Oh, right here. Are they here? Well, I went through some of the barriers. If you look at some of the barriers that people run into, education is one of them. Community safety zones. Community safety zones are the zones that for sex offenders where they cannot live. Workplace issues. Some of these people have been in a long time. They're out of touch with current times. Reading and writing, even just down to taking care of a checkbook. How do you manage your finances? Family integration. And then, of course, you have some of those bureaucratic barriers. Just getting an ID card for some people is a major chore. It's amazing. We would like to see an ID card issued, a state ID card issued before they leave the system, so that they have that, so that they can get a job, so that they can do the things they need to do, so they can cash their check. Social Security benefits is another one. So you can start to imagine some of these things that we take for granted no problem, no issues really, just go down and work through the system, that are just total barriers to them being successful in our community. Them throwing up their arms and saying, that's it, forget it, I'm done. And that's what this slide was for here. Are they here? This is a map, and this is a few months old now, but the dots are pretty much the same. That's where this is a map of all the parolees that live in Rapid City. And you can see the concentrations there. You've got a lot on the north side, you've got a lot towards the downtown, and a lot on the south side there. And why is that? Affordable housing. Exactly. That's what it comes down to. That's why you see those concentrations. And then I looked at the safety zones. This is just something we have to work around. Not to say that community safety zones are a bad thing. We think that those are important and that those are appropriate. Those are all the places in Rapid City where they can't live. But there's the dots. Same concentrations pretty much. Where they have affordable housing. Those are sex offenders, the yellow dots that you're looking at.
Why is that? Sorry.
Is it all worthwhile? We're going to find out. I'm going to let you go. I'll get out of here.
Sorry, I got my things on.
And then our focus clients. The only thing I want you to look at is that second bullet. The most difficult people to place are going to be our focus clients. Those are the ones that are going to need the most help. So why not just get right into the mix of it and start helping those people? Because if you can make those people successful, you can make almost any of them successful. And there you go. Thank you.
Aaron, did you want to ask your question now?
Well, my question was on the barriers, so I makes sense that you had a slide on that.
Okay.
The one that just popped into my head, it was on the ones that are most difficult to place. There was a bullet saying chemical dependency. So do mental illness, does that also fall under difficult to place? The other three bullets below that?
Very true, yes,
Okay.
because sometimes it's difficult to get employment so that they can stay out, or to get them into a program so that they can get the assistance they need to be able to stay out. Chemical dependency, I put the 90% there because the South Dakota Department of Corrections says that 90% of the people that come out have that issue, chemical dependency, alcohol or drugs or whatever it happens to be. That's a huge issue. Fetal alcohol syndrome is another one. There's several things that you need to take into account as to how capable will this person be when they get back into our community.
Brain injury is the other major issue. It doesn't fall under mental illness. It's not an illness, it's a brain injury from an accident, being beaten up, that type of things.
Thank you. Aaron, do you have a follow-up?
So if 90% of the people have chemical dependency, that means, and those are difficult to place people, 90% of the people who come out are difficult to place. That's quite a challenge.
And
especially when you add all the other things like having chemical dependency and being a sex offender.
Exactly.
Chemical dependency and mental illness.
That's what I was going to say, combination thereof, exactly.
Wow. Well, as Madam President said, I think we all appreciate your effort here, and we look forward to reaping the benefits. So thank you very much.
Thank you, Aaron. Lloyd LaCroix, please.
I just had a follow-up. As Aaron has stated, dual diagnosis people are really difficult because they got quite a few things going on. But one of the things that I think Barb and I both realized during that Eastbrook closure is some of the people that are, like you said, living in affordable housing. I had a person that I talked to who had been clean and sober for 7 years or 6 years, and their husband was too, but they couldn't get any assistance because they had a felony. And I think that just changed with getting food stamps just recently. But as far as housing goes, I think that can be, I don't know where that stands right now. But that was one of the biggest barriers for people. That's why they live in those cheaper places. They can't really get any help because of the felony.
Exactly. And that's what we're looking at here. What is our goal as a society?
Yeah.
Do we want to throw them back in prison and throw up the barriers? Or do we want to break those down and give them the opportunity to be successful here? We have to make a choice.
Do you have a follow-up, Lloyd?
That was just one of my concerns, and I've dealt with a lot of the people in the system, and there are some very great, talented people that if given the opportunity, could be very productive. citizens in the city. It's just a matter of sometimes the family support's not there when they get out, or maybe, you know, in certain circumstances. And so with this little bit of assistance, I think it could make a difference in a lot of people's lives as far as reoffending. And, you know, the Strength and Family Task Force doing a lot with prevention, with the dual diagnosis, the mental health type things, so that hopefully they don't get to the point where they get to prison from a felony, from theft or something along those lines. And so I think our community is really moving forward in a lot of ways. And I really appreciate your guys' work on this and all you do for Rapid City. Thank you.
Thank you, Lloyd. Aaron Costello, please.
Thank you, Madam President. I do have a follow-up. So to counter that, who are the easiest to place?
Usually the people that are the easiest to place are the people that are in for a very short amount of time. Maybe it's our DUIs, or maybe it's people that commit a felony, but it's not a high-grade felony. It's something that where they're in for a month or two and then they're back out. They haven't really lost their tie to the community. They haven't, in most cases, lost their family connection. And so those people may not need our help at all, or will only need one or two things from us to be able to be successful here. And so those would be the people that are probably going to be the easiest to get back into the community and get them going down the right road again.
Thanks, Wayne.
Thank you. Any other questions, council, of Wayne? I'd like to thank you, Wayne, for coming today and presenting this information. It's very good information. We'll go ahead and go on to Barb's programs.
I'm going to talk a little bit about the new programs and initiatives that we have. Oops. Oh, okay, there we go. One of them being the Second Chance Act grant application, which follows in with this reentry initiative, and that I'll go into detail on in a minute. As part of the financial empowerment that we're doing, our Strengthening Families Task Force for Better Outcomes for Youth and Children, really the basis of all of that is trying to build financial empowerment to resolve most of the issues that face. And I'm going to give you an update on their progress. And then our new Bank on Cities campaign, we were just awarded a technical assistance grant to help us start a Bank on Rapid City initiative, so I'll explain that a little bit. The Second Chance grant application is a joint project between the state and local governments and our private providers, and it's to help reduce that recidivism rate. And funds were just made available. Up to $750,000 is the maximum we can apply for. The Department of Corrections, the state is putting in a statewide grant from which Rapid City can then apply to them. The federal grant does require a 1-for-1 match. Of that $1-for-$1 match, half of that dollar, the matching dollar, must be cash, and the other half can be in-kind services. The DOC just made the decision this week that they would front the full $375,000 for the cash match, so we locally wouldn't have to do that, which was a great relief for us. And their staff salaries and in-kind match will be used for the in-kind. That'll then free up the money for the full $1,125,000 to be used for new services. It also relieves a lot of nightmares on paperwork in us trying to document our matches to them. So this it streamlines the process for both the state and the community. It would be an annual award, and it could be renewable for 2 additional years if they're funded. They have to put together a 5-year reentry strategic plan, of which we were instrumental in helping them because we had already been working on one for us. The focus for the state, now this is their application, is on high-risk inmates returning to Sioux Falls and Rapid City. We are the 2 communities with the highest population for offenders, and it will address the individual needs that offenders have that cause them to be at greatest risk of returning. The anticipated service domains, or the types of services that will be outlined in that state grant, are substance abuse, physical health, mental health, housing, employment, education, offender supervision, mentorships, victim services, and family support and reunification. Many times when they come back, there's a lot of issues within the family that sometimes that's what pushes them over the edge to go back. So we need to address those both for the family who've not had somebody there for quite a long time, and now the kids have to adapt to them coming back. Intensive case management will be provided. This is what we think will make a difference, is having that support system in place. And it will also be culturally aware. 47% of our returning offenders are Native American. So the cultural difference in welcoming them back to the community is built into our program here locally. Priority activities that we at Rapid City would be looking at funding. We tried to look at what our gaps are and to fill in our gaps in our community. So when we apply to the state, we'd be looking at housing assistance, family reunification services, mental health, brain injury, and fetal alcohol syndrome treatment, and mentorships, and the local coordinator for the program management. That's going to be an important part of it. If the state's awarded the grant, Rapid City would apply to them for our funding. Funding likely will not happen until the September-October timeframe. They should be making the decision probably in the June-July timeframe, but funds wouldn't actually get released or be available for us, and then we would have to go through an application process with the state. So it's not going to happen next month that we have dollars flowing. On the Strengthening Families Task Force, did anybody have any questions on that part before I move on to the next section?
Any questions on the first part, Council? No? Thank you, Barb.
Okay. Strengthening Families. This was started back in March of 2007, and the city adopted the resolution in July of 2007. Rapid City was the 73rd city and the 31st state to adopt the NLC platform. We've been moving forward with that, and what we did was we brought together a group of interested stakeholders, and we sat down and tried to identify high priority issues in the community, and we came up with about 15 that we felt were the highest need. From there, we reduced it down to 6 that we would try to address, and we set a time limit that we would try to address them in 1 year. Those 6 were the truancy and dropout rate, creation of a youth council, early childhood development, transportation, mental health and substance abuse, both prevention and treatment. The committees reviewed all of the issues among those topics. Those who were interested then became part of those committees, and they were tasked with identifying 1 or 2 goals to work on in that first year. In truancy and dropouts, what we did was we also asked for somebody to be the lead agency or lead person to make sure that that committee kept moving forward, because I haven't yet been cloned. So we got volunteers for it. In Act Now, Jeff Norris and Judd Thompson agreed to be the leads, and they have a full committee of many other partners in our community. But the goal they chose was to try to do an amendment to legislation that regulates the minimum dropout age. That is being increased as of July to 18. Before that, anybody could drop out at 16. That creates a big problem of a lot of kids who've been out of school for 2 or 3 years that now have to go back to school, or they can be put into the criminal system. And Judge Kern and the rest of the system don't want them there. So there are some amendments to that legislation that they're pursuing, and they did get one passed in the House, the State House, and I haven't heard yet whether the rest of that's gone through yet or not. They also, their goal is to abolish chronic truancy, and they've been working on that by addressing transportation issues, collaborating with the principals, trying to get all the school principals involved, VOTEC schools, transition coordinators within schools to work with them and the kids, parental workshops to try to help parents know how to deal with the truant kids. They've done some truancy sweeps, of which the most recent one they did, actually they didn't find anybody. All of the ones who were out, they were found at home with parents, and it was usually an illness. So it's starting to make a turn in that. Also, the need for cultural education opportunities for Native Americans, and those are a couple of the examples that they wanted to do. For the Youth Council, the creation of a Youth Council, Lifeways, Paula Wilkinson Smith agreed to do that. They've been working with Youth Council on a limited basis, not quite the scope that we were looking for as a city. So one of the first goals they set up was, let's do a survey of the youth and find out what it is they want, what they feel are the needs and the missing gaps for them in the community. because if you don't have the youth buy-in to what we do, like skateboard parks or anything else, if it's not what the kids really want, if it's what we think they want, it's not going to work. So we want to get their input. And then they will form, once they have that survey done, and the survey has been posted, it's been on the web and put out to all of the schools, and they should be compiling the results of that this month or next. So that has come along. And then from there, using that information, they will form the youth council. The youth council will not be made up of all of the A students in town. It's supposed to be a broad spectrum of the kids, not just the most popular. Although you do need to have good leaders on there as well, but this is an opportunity to bring those who don't feel they have a voice into the mix. Early childhood development, and this also includes child care. South Dakota Voices, Rebecca Andrew is leading that committee. Their goals are to build public will in the community on child care and early education, to help the community understand what a problem this really is, especially for our low-income households. The lack of child care, good child care, and the cost of it, and the hours that aren't available for many low-income people who work shift work. So they're looking at that to get public information out, and they've already been very active with that, and to identify and understand the needs of the pre-K and child care in the community. So they're doing a parent survey, and the survey was put out in February, so they'll be compiling those results within a month or two. Transportation, Lloyd agreed to head up that committee, and he works with Rich Sagan and myself, and some of the things that were identified right off the bat were bus route times to match school start bells. The city bus system ran to where the kids would be late to school with the way the bell system, so they worked with the school district to see about them changing their bell times and see whether the city could modify the bus route by a few minutes to make that work, and they did. Changes in bus stop locations. We had locations where kids were having to cross very busy streets. Bus service for swing shift workers. That's something we're still trying to work on. And buses to accommodate appointment schedules and work schedules for many offenders and homeless who don't have the ability to get to their appointments. We're working on trying to many of the agencies out there are already funding their own little vans, and they're using their high-paid staff, their counselors, to run the clients back and forth to various needs and appointments as they need them. And so we've had a discussion about how many of them would be willing to give up a small portion of that budget. If they could get rid of doing that job themselves, would they, since it's already in their budgets, give up a portion of it to put into a pool where clients of their agencies, and there are 4 or 5 of them at least, we could then run a van system that would help get their clients to their late night jobs. Many of them, the bus runs until 10, I believe, but that doesn't really help store workers who have to stay and close up and clean. You know, they can't, when the door closes at 10, they still have a half hour's worth of work before they can leave sometimes. So the hours and the weekends, some of our offenders who have to get out to sites that are outside of town, if they're doing construction work or highway work, they need some way to get there. And so we're looking at trying to do that, and I've got positive feedback on it, so that's something we're moving forward with. Mental health and substance abuse, their goals, because they're also doing prevention and treatment, and this is probably one of our biggest issues that faces our offenders, our homeless, is a mental health issue of some sort or substance abuse. They have decided, they haven't come up exactly with all of their goals yet. Vakurovich Foundation stepped in and paid for a coordinator to try to work with them through a whole new system of care for mental health. And so they're moving slower, but they're going to really firm it up, and what they're looking at is prevention. On that committee, it's the Front Porch Coalition. Stephanie Schweitzer Dixon is heading that one, and treatment is a co-chair between Eileen Lear and Linda Kohlhoff from City County Alcohol and Drug and Volunteers of America. And their goal is to build a sustainable model that all of the stakeholders are involved in, including the client. Their model will address prevention, family advocacy, which they feel is very important for it to work. The family has to be involved in the treatment of the client also. Service integration of all of the agencies working together as we're doing, as what Wayne said on our reentry program. It's the same concept that they're looking to do, and service infrastructure. Then I'm going to move on to our Bank on Cities national campaign. And this was a technical assistance plan that the city applied for.
Barb, sorry to interrupt
sorry.
you. Erin has a question from the Strengthening Families.
Yes.
If it's okay, just
Yes, certainly.
kind of do it section by section. On the creation of a youth council and the youth survey you're conducting, are you doing, so it's an online internet survey, is that, and what other forms, or how else are you trying to reach the students?
It's both paper, hard copies that they've put out in the schools. It's in the library. It's online also, because many of the students have access to the internet through the schools. And so they can do it both ways, and it's been distributed at the Y and all of the places that kids go to or are involved in.
Okay, that's great, because I think there's one unique thing about trying to survey students. You know, one of the hardest things in surveying anyone is going to where the people are. Well, fortunately, all the students are at school generally, so
Right.
hit them up, or the YMCA. That's a great choice too. What type? Do you have any idea of the response you're getting on that?
Not yet. They haven't. They're still collecting the
Mhm.
information. I understand that they've received a lot of responses so far, but they.
But no numbers, no hard numbers
No.
yet? Okay.
At the last meeting, they said that they would probably be, and it's Dr. Usera from the Cheeseman Foundation who's going to be compiling the results. He's the one doing the survey, and they expect to start compiling those next month in
Okay.
May. So
Do you have a copy of that survey available by chance?
I do. I can
Okay.
forward that to you.
I appreciate that. Thanks.
Sure.
And then this second part is dear to my heart, and that's the transportation. And I'm really excited to hear that you're making the steps to make the transportation more usable. And I think, Lloyd, it's fantastic that you're heading that up, and especially for the students. I think that this is just a comment, I guess. The steps that you're taking to accommodate the schedules of the workers is going to move well beyond. Well, I think if we were to incorporate that in public transportation, that would move well beyond just being an advantage to them. I think that would be an advantage to the community as a whole. And I just got back from the National League of Cities Green Cities Conference, and transportation was a big part of that. So I think that's something we need to aggressively pursue, and I hope I can play a part in that. So thanks.
Thank you, Erin. Lloyd LaCroix, please.
Thank you. First, I'd like to thank Barb for all her work on this, and Malcolm both. You know, this type, that Strengthening Families was, you know, I planted a seed and it grew. I mean, from the community leaders that were involved. But I just wanted to answer some of the questions that Erin might have questioned. We kind of changed the name of the group from Youth Council to Youth Engagement Committee. But our next meeting we'll try to set up for the first part of next month. And as far as the survey went, that when, you know, we had youth input on that. We had, I believe, about 5 meetings on just getting information, trying to gather a lot of information for not only truancy part, but other different areas. And Dr. Usera was fantastic with it, because he'd have a sample one week, and then next month he'd come back and we'd change our mind, you know, and have more questions or rewording things. And even the youth that were coming to our meetings, you know, they pretty much told us, you know, you need to word things this way because you're getting too complicated or something along that line. So we've had some of the youth leaders in our community who took great part in putting their input in and so forth. So, but I just wanted to mention that Barb has done a fantastic job with this. I don't think she knew what she was getting into when she first come in. So thank you.
I also would like to thank Lloyd LaCroix, and big kudos to Lloyd, because he's been a big part of this. He's put his heart into this, and it's something he's enjoyed, and you can tell when he talks about it off the dais or otherwise. And we just appreciate Lloyd putting in his extra time that he has for this program, because he's made it a success as well with you and Malcolm, Barb. So thank you as well, Lloyd. And any other questions? Okay, Barb, you're on.
Okay, our Bank on Cities national campaign, we had the opportunity to apply for a technical assistance grant to implement a Bank on Rapid City program. And we were one of 8 cities that were chosen. The other cities were Bryan, Texas, Denver, Colorado, Gaithersburg, Maryland, Indianapolis, Louisville, Kentucky, Newark, and St. Petersburg, Florida. So we have a really good cross-section of other communities that are going to be participating in this initiative. We want to have some help in setting up. We've already been working on many ways of building wealth and assets for our community, but we need to take it to the next level now. And this is going to give us that technical assistance we need with new ideas and help on how others have already done it, so we don't have to reinvent the wheel and start from scratch. Many of the assistance programs that help low-income people right now are just reactive. They don't actually address the root problem, which is they just don't have enough money coming in. And if we really look at how are we going to make a difference for low-income people, the only way is to help them figure out ways to increase the money that they have coming in. We won't be able to do it for everybody. There are some situations where they may not be physically able to do anything else to change their financial situation, but many of them we can. Some of those ways are get a job, get a second, third, or fourth job, improve your job skills so you can get a promotion or a better paying job, additional education so that you can have a better earning ability, win the lottery and inherit money. And unfortunately, most of us won't have the advantage of the last two, so we have to do it the hard way. What they will provide to us is customized technical assistance from them and other national experts on building assets. It's a 1-year project. They will have monthly conference calls with our group here. We'll form a committee and we'll have conference calls with NLC directly, and then we'll also have crosstalk calls with the other 7 cities that are in the group with us, and sharing ideas and how they're doing things and problems to kind of help talk each other through it. They will also have on our calls the cities from last year. There were 9 cities who were chosen in the first round, and 5 of them already have their programs up and running. And so they will also be telling us examples of what works, how they got people together to try to help it make it go faster and easier for us. There will also be at least one cross-city convening, probably during one of the National League of Cities conferences, where all of us that are in this group will have the chance to have a meeting together, sit down face to face, some new learning opportunities and networking. Oops. Our goal is to make available to all residents the tools and products they need to achieve their financial success and self-sufficiency, and to improve their financial situation through education, asset building, and life skills and job training programs. So it's kind of a broad spectrum. We're going to hopefully reduce the number of people using high-cost check cashing and title loans by 33% within 2 years. That's kind of a goal we're going to set for ourselves. I mentioned that we have some programs already in place, and a lot of people aren't aware of all of the programs that are in place already, and which we will be building on. And one of them, the key ones, is 211 Helpline. This is a way to connect people to the services they need. Many people are eligible for assistance and they aren't accessing it because they don't know about it. And as a service provider at one time, I know how hard it is to know what everybody else in town is doing. 211 is, they've taken the place of our old operator assistants. For those of us old enough to remember, you dialed 0 and you got somebody and you could ask them, what's car dealer over on 5th Street? What's the name and the phone number? We can't do that anymore without paying a high fee. 211, you can dial the number 211 and say, I need help with food. I need food. My family is short this month. Who can I go to for food? And they will give you the whole list. The service is free, and it does a couple of good things for us as a city. The city has contributed some funds to help 211 get up and running. And it provides us data on the unmet needs. They report to me monthly on the number of calls from the Rapid City area and what the calls were on, and calls that weren't able to be filled because they were asking for a service we don't have. So this is going to help us as a city determine where our gaps are and also where is our highest usage. They also have a suicide prevention line on there. This is what the screen looks like when you pull it up. If you go online, you can either call them and verbally talk to them, or you can go online and pull up the address, and you can choose your city, and it brings down that drop-down box that you see there on the right, and it has everything. So if you want food, you go to the word food. If you want alcohol, maybe it's an alcohol issue, substance abuse or treatment that you need, not just bottles of alcohol, although they probably would tell you.
Tell you where to get alcohol?
They have just about everything, and it's not just these services. They have government. It's helping us to not have to put a 311 line in for government. They list all the government agencies also on this. But just for this trial, I said food. I plugged in the word food, and unfortunately, my slide won't show all of it, but it brought up about 8 agencies that provide food. The first 2 on the list were Birthright and Canyon Lake Senior Center. Then it goes on down through the social services and Cornerstone Mission. If I were to click on one of those, it will then bring up the information about the agency. And in this particular one that I clicked on, they provide food stamps, TANF, and medical assistance. It explains a little bit about each one of them. So this is a very easy way for people to find out. It's a way for service providers, who if they have a client sitting at their desk, to go on and find out what they need. I use it. I've had homeless, I've had offenders, I've had people who were foreclosed on walking into my office, and this is what I use to help figure out who to send them to, because I don't have all of those services. One of the things that we have also in place is AARP and VITA sites for free tax preparation. VITA is the volunteers group that does it, and AARP. Many people don't know that AARP does free tax preparation for anyone. You don't have to be a senior citizen, but they focus on seniors. But they also will do it for anybody who's low income. Those are the sites that were open this year for assistance. What they do is they help people get linked up. One of the main sources of revenue that people are not tapping into is, if I go back, is the earned income tax credit. And that is a place where many of the people who don't file a tax return are still eligible to file for earned income tax credit and are not doing so. And off of the 2000 census, it showed that we had about 18,000 people who are not filing for that, and whose income are in the guideline ranges that they would qualify for it. There are a number of reasons why people might not file for it, but this is a service that is available to them. They could go in and help get it done free, and if they open a bank account through our initiative, we are able to link them with an account. They can actually have that return within 2 to 5 days. So this will help to get more money into their pocket, and considering that they can get up to a little over $4,000, depending on their family size, for many low-income people, that's 4 or 5 months worth of living expenses that they're missing out on right now, and sales tax dollars for us in the city. If we're wanting to know why the city cares about them doing that, there's also the revenue. They will spend those dollars in our community for other things. One of the things that we already have offered in town are individual deposit accounts. These are relatively new. Both Western South Dakota Community Action and Consumer Credit Counseling Service of the Black Hills are offering these programs. And what it is it's an incentive to get people to save money. And part of that is when you're dealing with very low income people, they are already living paycheck to paycheck and sometimes not even paycheck to paycheck. And so savings doesn't even enter their mind. But by providing an incentive to make them make that hard choice, you know, if a good enough carrot, somebody will make the cuts and do it long enough that it becomes part of the idea behind this is that you're doing it over a period of at least a year. And that will set it up to be a habit. They get in the habit of savings money. And so what we're trying to do is help them understand that saving money is good. And what these do is they will match their dollars. So for every $1 that someone saves on the Community Action Program, they will get $3 in match. So if they save $2,000 over this year, they will get matched $6,000. They'll have $8,000 to spend for their down payment or closing costs on a house. There are specific limitations to what the money can be used on, and they are all for empowerment. And those are to start their own business, to purchase a home, which is the biggest asset anybody can get, to continue their education or job training. So if you have those things that are going to help them improve their earning power or give them that cushion to fall back on through their homes, this is an incentive to do it. Consumer credits is a 2-for-1 match. So for every $1 they save, they get $2 from consumer credit. And CAPS can be done. They actually service an area of up to 16 satellite sites through pretty much all of western South Dakota. Consumer credit counseling's money is our block grant fund, so they're limited to people who are just inside the city limits of Rapid City. We have also put into place the use of our poverty simulations. We bought that kit last year, and about July, I believe it was, and we did our first poverty simulation on September 23rd. Since then, we have done a total of 6 for over 500 people, and I have 3 more scheduled for the coming 2 months. So we bought it to help raise awareness within our community of really what do people living in poverty go through. We think we know, but the simulation kind of shows us there's a lot more influences going on than what we are aware of. Those of us who don't have those challenges, those of us who have transportation, and we have jobs with paid vacation, there are a lot of other things that go on in their families that we don't think about. And we think they're just lazy and they just aren't doing, you know, if they just did more. But this helps you to understand that sometimes that's not what it is. We also, as part of this initiative, are looking to try to address the fringe banking services and industry. Right now, that would be considered payday loans, title loans, check cashing services, pawn shops, used car dealer financing. Those would be the fringe banking rather than mainstream banking, which would be our banks and our credit unions. Fringe services offer high fees, high interest. Fees can be up to 10% if they are check cashing. It could be like $3 per check or up to 10% of the check amount as a range. Interest rates, consumer credit counseling, I put down 300% because I knew about that. They say they've actually seen some of them come into them that are up to 800% interest on loans, the title loans that these folks are getting. And they're the ones who can least afford to pay those kind of fees. But their locations are convenient, they're in their neighborhoods, they're friendly, they're non-judgmental staff, unlike some of the banks that people might walk into. There's very little paperwork for them to do, unlike if any of you have done bank loan recently, you know, it's usually a pile. I was a lender, so I can speak to that. There's lots of paperwork. And they get quick receipt of their funds. They don't have to wait 2 or 3 days for it to go through underwriting. They get their money right then. So that's kind of why they go to them. It's convenient, and many of the banks, because they may have overdrawn in the past, won't provide services to them. Financial education is another part of it, and it's one of the most important. And here in Rapid City, those are all of, you know, the programs that we have, or at least most of them. Love Inc. is not up there. Life Inc. They provide financial assistance also in financial literacy courses that I didn't have on there. What we are going to do, we're going to form a team of people of all of the different disciplines and of stakeholders. We're going to formulate some goals. We're going to create partnerships with the lending institutions to try to make products that the low-income people can use. that are not 800% interest. We want it to be reasonable and affordable, and we want to encourage them to save so that they can build. And we'll be doing outreach to the community and to educate the community on the use of those products. That's our goal for that program. And I'm done.
We do have a question, I think, from Lloyd LaCroix, please.
Thank you, Madam Chair. First of all, I want to let you know how sneaky I was by not going to Washington with you, because I knew Ms. Hadcock would go, and she attended the program with you, and me knowing Deb, it sparked her interest and got her going, so I think I did a good job on that. Kudos to Lloyd.
Good job, Lloyd.
But, you know, in all reality, all the programs that you've just discussed, Barb, you know, the Strengthening Families, that was brought back from the National League of Cities. And we won a grant on that and went through that also. And the poverty simulation, that come back from the YEF Institute's summit in San Antonio 2 years ago, and that's also from the NLC. And again, this Bank on Cities is part of the NLC that you just got a grant. And so, you know, us as city council members have, and staff have received a lot of help from the National League of Cities. So I just wanted to shoot out some kudos, you know, one to Mr. Chapman for bringing NLC into light for me, because, you know, I got heavily into it, and that education part of it was very important for me as far as getting my credit hours and what I've learned there. And I wanted to thank him for his part in affordable housing and in the task force and all he's done for our community as far as getting us involved in that. And you know, another thing I wanted to thank is not only Malcolm, but the mayor and Kevin Tome for actually giving you some help, Barb, because you got a part-time additional person, and because with all these things going on, I believe community development's got a lot on their plate, and it's going to need some people to take some of that portion, you know. So I think that's going to be really important for us come budget time too. So, but I just wanted to thank all the council members present for all they do, and look forward to serving the next 10 years till I retire with you guys. 30 years, I should say.
Did you get that on paper?
Thank you.
We'll have your signature after this. Any other questions, council? Again, I'd like to thank Barb and Wayne and Tony that's going to take over the program for the reentry program. Barb, you can't get enough kudos, I'm sure, from the council and the mayor and Kevin Tome, only because you do work hard, and hopefully we can get you more people to help you with your programs, because you do a great job. So thank you for coming today, and council, thank you for taking your time out today and getting informed. We have a motion. Barb, do you have anything else? No? Okay.
We love you, man.
Motion to adjourn?
So moved.
Second.
Second.
Aye.